Artificial powered diagnostics is changing the landscape of healthcare in India with a new emphasis on disease prediction and lifestyle interventions rather than post-facto cure. What if someone could tell you sufficiently in advance what disease you're likely to get in the future and you act on it so that possibility does not come to pass at all? What really is predictive healthcare and what is the size of the market? How does predictive analysis work? What is the AI advantage and what are the challenges?
We have all had health checkups. Our sugar levels, our thyroid tests, our hemoglobin levels, and everything else that your complete healthcare package can offer. But can these routine tests predict if you are going to develop dementia in your sunset years or have cancer at some point in time? Will you face hearing and sight challenges when you grow older? Or are you prone to developing arthritis? They cannot. Predictive health diagnostics powered by AI will do just that. Predictive analytics in healthcare entails the use of data to assess the possibility of disease before it has actually set in. It can be used for healthy adults who, if found predisposed to a particular disease, can, with the help of lifestyle or medical interventions, avert it altogether.
The scope of AI diagnostics is actually phenomenal. The way it has and the way it will revolutionize healthcare is going to be something that will be very exciting for all of us to witness in the years to come. From a diagnostics perspective, AI has already in the past many years automated a lot of steps in the diagnostic chain that were actually manual earlier. This leads to a higher throughput, so that means more samples can be processed at the same time. It also leads to more accuracy, more precision, that is reproducibility, and at the end of the day, more reliability on the results. So essentially, AI will not be replacing the doctor, but it will be the doctor's assistant that will help the doctor and augment the doctor to make a better diagnosis and adding more value to the entire chain of care continuum of any patient who visits a healthcare facility.
In predictive healthcare, we use multiple factors, such as patient's environment, genetics, and some blood parameters to see if he or she is at a higher risk for a non-communicable disease and come up with a personalized preventive plan.
It works on the available data, so if the data is voluminous and obviously with the coronary artery disease and lifestyle related diseases, even in the case of cancer, we have voluminous data available, so it can analyze the data which is available and the risk factors that the patient has. Say, for example, a patient with who is 45 years of age, he has got strong family history, like his father or mother has a heart disease, existing heart disease. Also, if they have got diabetes, and the patient has got high lipid levels, his lifestyle is mostly sedentary. So all these risk factors can be analyzed, and they can be analyzed by the artificial intelligence.
CT scan data to help predict early lung cancers, COPD, and interstitial lung disease.
It is being used a lot, not only in diagnostics but also in treatment. Like our mechanical ventilator which we use in ICU, they work on algorithms. Non-invasive ventilator which we use in management of many diseases in pulmonary medicine mainly, they are AI based, they work on algorithm. Then our pulmonary function testing which tells about lung capacity, they work on algorithms and work on AI. So definitely with more robust backend data, with better diagnostics and better algorithms, we have a lot of place for AI in medical diagnostics.
Rehabilitation is such an important and integral part of cardiac, surgical and heart-lung transplant programs. And also in neuro programs, where the patients recuperate after stroke. They've got varying kinds of disabilities, And we see in our cardiac surgical and transplant patients, these patients have got gait abnormalities, they've got muscles which are weak. Artificial intelligence is a new tool that has sort of reinvented how we give physiotherapy to all our debilitated patients. Especially it helps in planning out what kind of treatment should be given to the patients.
Powering this predictive healthcare revolution is artificial intelligence, which has already permeated many aspects of human life and has come to healthcare too. AI, along with the Internet of Things, machine learning, and other cutting-edge tech, has now spawned what is called the IOMT, or the Internet of Medical Things. AI produces algorithms out of vast amounts of data that help in precise and speedier diagnosis and treatment.
AI would be the one thing which will be going to do wonders, because many people are scared. When I talk about the people in age of 30 to 50, they are more worried than elders nowadays, because they really don't know why one of the colleague who was sitting along with them, why he got died. So that is the thing. If they'll get a thorough assessment of theirs backed by data, then they will at least give respect to their health. In previous era, we used to see heart attacks after 50s. Now 21 years, 28 years, to an extent because of the bad quality of life, too much of junk, bad food habits, a lot of alcohol and smoking. So that is giving bad health. So yes, this would be a one-stop shop. AI would really change the world.
Dr. Rai Siktupal on this kind of diagnostics picking up pace and on takers for it, since AI-based predictive analysis is most useful in the field of diagnostics. The growth in that industry is indicative of where India is headed, even though the numbers may appear modest at the moment. A 2023 report on AI in diagnostics in India by market analysis firm Insights10 has projected its growth from $0.02 billion in 2022 to $0.24 billion by 2030. While early diagnosis, better treatment outcomes are the positives of AI in diagnostics, the challenges of AI are false negatives and limited data set.
For any diagnostic test, there are two most important things. One is the clear image which we get. Second is how accurately we can detect the abnormalities or problem. So we are using ultra low dose CT scans where we are using less than 97% of the radiation which are normally used in any CT scan machine, and we are enhancing the image by using AI. And once we do that, then in a very clear image we are able to detect abnormalities by using AI, and we report it to doctor that how exactly is the problem, and then doctor can suggest that what kind of treatment should be given. That's how it works.
The positive side of AI diagnosis are better treatment outcome, whereas the challenges related to it are false negatives and a limited set of data. For now, there are some challenges related to AI diagnosis, but let's accept it. AI is the future and we should be ready for it. With camera person Sachin Chandok, Ishwara Radhakrishnan for India Today.